Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rania Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is cardiac arrest. We'll be discussing how to recognize cardiac arrest and what to do if you are seeing someone going through cardiac arrest, as well as treatment and prevention. Joining us today is Dr. Michael Abraham, Chairman of Emergency Medicine at the University of Maryland Upper Chesapeake Health, and Julie Sejak, Nurse Manager of the Community Outreach and Health Improvement at the University of Maryland Upper Chesapeake Health. Welcome to the show, and thank you both for being with us today.
Thank you.
Great. So if you both don't mind, to please just take a moment, introduce yourself, and just explain what the connection is to the topic of cardiac arrest.
So my name is Michael Abraham. I'm one of the physicians at Upper Chesapeake Health. I'm the chairman of the emergency department, and so not daily, but quite often I'm dealing with victims of cardiac arrest in the emergency department. I also am on the board of a foundation that helps teach AED, which is automated external defibrillation and hands-on CPR to the public for free. So.
Wow, thank you. Julie?
And I'm the nurse manager for community outreach at Upper Chesapeake. And I do a lot of work in the community and my team about cardiac health and prevention.
That's awesome. Thank you both so much for all your work in the community. It's appreciated. So let's dive into the topic. So if you can explain what is cardiac arrest and what happens in the body when it occurs, the difference between arrest, heart attack.
Sure, I'll take this one. So a cardiac arrest is very simply when your heart stops beating. Right? Everybody knows that your heart has to beat to maintain blood flow to your brain and other organs. But for whatever reason, the heart has stopped working and it is no longer beating electrically to cause blood flow throughout the rest of the body. So at that point, usually the person loses consciousness, stops breathing, becomes unresponsive, and pretty quickly will die if nothing is done. And it can happen almost instantaneously, unfortunately, and it can happen anywhere at any time.
And what are the causes of cardiac arrest?
So most often the main cause of cardiac arrest is that the the electrical activity of the heart ceases. So for your heart to beat, there's an inherent electrical activity, and that gives you your pulse, and that's the normal way the heart beats. When this malfunctions, becomes erratic or doesn't work properly, the electrical activity doesn't work in a rhythmic fashion, your heart just stops altogether. And that can be caused by a heart attack and be caused by other different things, but mainly the electrical activity has just stopped. And once that electrical activity has stopped, your heart won't beat in a regular fashion. So the blood flow to the brain and the blood flow to your heart and the blood flow to your lungs ceases and you lose consciousness. So it happens very quickly because the interplay of your heart, the electrical activity has to work almost perfectly for your heart to beat every minute.
Interesting. So who would be the most at risk to have a cardiac arrest? Does age play a factor into this?
Yeah, as you get older and you have cardiac risk factors, which we'll talk about in a little while, and you have heart attacks, a heart attack can lead you to have a cardiac arrest. They're not the same thing. You can have a heart attack without cardiac arrest, but a heart attack does cause you to have a higher risk of cardiac arrest. But it doesn't work backwards. A cardiac arrest isn't always caused by a heart attack. As you get older, those do become more prevalent. Some people have congenital abnormalities, as you can be born with an electrical deficiency or an irregularity that precludes you to have this. There are some family hereditary things that happen that can cause it as well. But there's been, if you've watched the news or if you've watched any social media, there are children that are playing sports and just drop dead from these cardiac events. Professional soccer players, football players, these can all happen. We saw it in the NFL recently, and basically that was a cardiac arrest from an electrical abnormality.
Yeah, and I think it's really important that we're having this discussion today because I think it has been a lot in the news recently. Like you've mentioned, we've seen it in the NFL, we've seen it with younger children in sports. So it's just really important that we're bringing up this topic and understanding that it's, it doesn't just affect like a really older person. It can affect people in different ages. So that's really helpful to explain to our audience. So the next question I want to talk a little bit about is how can we prevent or lower our risk for cardiac arrest?
Do you want to take this one about some of the prevention questions?
Sure. So I think first and foremost is living a healthy lifestyle. Exercise, good diet, and having a great relationship with your primary care physician is super important. Having those annual labs done and double checking on all of your health and well-being is absolutely necessary to help prevent cardiac disease and other diseases as well. In our county, we offer a variety of prevention programs like blood pressure screenings and evidence-based classes, and those evidence-based classes can be a one-time class or a year-long class, and they address healthy lifestyle and healthy living options.
That's great. And evidence-based is really important because when we say evidence-based, we know that it works and it's done before and it works. So it's really important that then we offer this to the community and they take advantage of it because we've seen in studies that it can really help lower your risk.
Right. And most of the classes are free to here in Harford County. So that's an awesome option for people.
That's awesome.
I said before that one of the problems with cardiac arrest is it can be congenital or hereditary, and so there are some family history things that your primary care doctor can pick up on from a family history that may alert them to look out for it. And another thing is smoking prevention is probably one of the biggest things that people can do. I know it's kind of, we talk about it so much because it's, it's out there, but smoking is probably one of the worst things you can do for your coronary arteries. And the more you smoke, the more likely you are to have heart disease, whether that's a heart attack or causing sudden cardiac arrest from a heart attack. So smoking prevention is probably one of the biggest things you can work on from a health standpoint.
That's true. And speaking of Harford County, our smoking rates in Harford County are still high. They've been going down throughout the years, but just still seeing those numbers, we really have to kind of work on bringing those numbers down. So it's great we have a lot of resources in the community for that, and so thank you. How does, now we just talked about smoking, but how does then stress play a factor into cardiac arrest?
I think, so when you, stress is hard to quantify, right? The stress for a person, one person's stress can be completely different than another person's stress. And so it's a hard thing to quantify. I think your body's reaction, we were never designed to be under stress the way we are constantly for this long. And so, traffic or, bills or any of the things that people can be, quote unquote, stressed about do play a role. And your body reacts differently. Everybody's body reacts differently. But the more stressed you are, the higher your resting heart rate is, the higher your heart has to work, the higher your blood pressure can be. And so all those things lead to some premature coronary disease and definitely can have an effect. There's never been any, stressed person cardiac arrest complete linear connection, but you see it enough that high stress jobs, people have premature coronary disease, and it may also be because of the lifestyle they live in those high stress jobs. Coffee, lack of sleep, smoking, those types of things that go along with high stress jobs as well. So it's hard to differentiate all those, but it does play a role.
Okay, great. According to the CDC, more than 356,000 people have an out-of-hospital cardiac arrest in the United States every year, and about 60 to 80% of them die before reaching the hospital. How can we increase the survival rate for someone in cardiac arrest?
It's very simple. Learn to do CPR.
Good quality CPR.
Yes.
Good quality CPR is probably the only thing that will get more people to the hospital. For every 10 seconds that a person does not have CPR when they're in cardiac arrest, it leads to an increase in mortality of 10%. So if after a minute you haven't done any CPR for that person, there's over a 60% chance that they're going to not live. And if they do live, they'll be brain dead, basically. So you can imagine if by the time you call 911, and even in a county as big as Harford County and Cecil County, where ambulances have to drive a long way to get to someone, if you're waiting for them to get there and you're not doing CPR 3 minutes, 5 minutes, even if they were very close to EMS providers, it's a long time to wait without blood flow to the brain. So the most important thing that someone can do is CPR.
Yes.
Absolutely.
I think too, when we talk about like CPR, a lot of people think, oh, well, I'm not in, I don't work in the health world, so do I need it? And the answer is everybody should learn CPR, and learn CPR for the different ages too as well. I believe that it's different for if you're performing CPR on a baby versus a child versus an adult. So I think, again, just pushing that, does not matter who you are, what you do, that we should really pay attention to learning how to do CPR. I mean, there's so many classes out there, so I think that's important.
One of the big things that was changed maybe 5 or 10 years ago in the guidelines was bystander only hands-on CPR. So you don't do rescue breathing.
Yes.
And a lot of people are like, I'm not putting my mouth on that person, or I'm not going to help, or and so you don't need to do that. You can just do CPR, chest compression CPR, and that will work just as well as trying to breathe for somebody. So if you're not equipped or trained, just learning how to do the chest compressions is perfectly fine while you wait for the EMS providers, because that'll continue to circulate blood to the brain and allow the person to not suffer any brain death from doing CPR. So.
And so we just talked about, using the AED. So it's really important too that we have the plan when we get to an area, or if we know we're at an event, even a sporting event, knowing where the AED is that correct?
Yes.
Making sure that you do have that hands-on CPR information. Now, let's talk a little bit about health disparities in relation to cardiac arrest. Do we see health disparities in relation to cardiac arrest or heart health in general?
Yes. So in 2022, the New England Journal of Medicine put out a large article stating that victims of cardiac arrest in lower socioeconomic status areas suffered worse outcomes.
Okay.
So one of the focuses of Compression Shock, the foundation that I work for, is to get AEDs and teach CPR in low socioeconomic areas, so that those patients and those people that are that don't have or are afraid of access to care, or for whatever reason they feel like they can't get to the hospital or are afraid to call 911, learn CPR and learn how to use an AED so that they can help their survival rates increase.
Okay. Anything else you'd like to add for that?
I think we kind of skipped over the AED part and the AED utilization.
Yeah, so let's talk about AED utilization. So how should we use an AED? I know it's a little bit hard because we don't have an AED in front of us here, but what would be the best way to kind of discuss how we can use an AED if someone goes into a cardiac arrest?
I think one of the things, before we talk about how to use it, I think we have to talk about that public outreach of getting them everywhere.
Yes. They need to be everywhere. And they are in a lot of places that people don't really realize. Most stores and malls, and they all have AEDs. Generally, a lot of times they're near the restrooms. They're usually on the wall with a sign that says AED. So just, if you know where it is, or it's great to know where it is, and if you witness somebody having a cardiac arrest in a public place, send an employee of that store to go fetch that AED for you if you're helping the victim.
You can actually buy your own AED on Amazon and just buy it there. I mean, I think they're anywhere from $200 to $500 to $1,000, depending on the version you get. But you can buy one and have one in your car. You can take it with you. You can take it to sporting events and have it if you're going to big group events where there may not be one. And so they become a lot more accessible in the recent past. And I know some people can even use their health saving accounts to buy AEDs from certain companies, so they don't even have to use their own money. But like you said, every restaurant, gym, business should have one on the wall nearby, because you never know when you're going to have a cardiac arrest. And even if it's not someone, could be somebody walking down the street nearby, and you just could be the nearest place that could have one. So EMS vehicles obviously have them, police vehicles have them, and they're all standard in those situations as well. But when a person looks like they're having a cardiac arrest, it can be very misleading. They could look like they're having a seizure.
Okay.
Basically, if the person is struggling to breathe, or if they're not responding to you, if they've collapsed and they're not breathing normally, just like rhythmic breathing, then you should always assume that they're having a cardiac arrest.
Okay.
That's the safest thing to assume. If they're having a seizure, which often looks like a cardiac arrest in the first stages, if they're breathing okay, they'll start to breathe normally, and you'll be able to check for a pulse. But if the person is not breathing normally, that usually means their heart has stopped.
Okay.
And you should just start CPR and look for an AED to apply.
Yeah, make sure someone's also around. Call 911.
Yes,
It does take a
Yeah.
team. It does take a team. It's,
Yeah.
I know that when we say the word bystander, just because there's a bunch of people around doesn't mean that you can assume that there's someone else that's going to be helping. Act right away. We can't just assume that someone else in the crowd's going to help. So I think it's a really good collective, group effort if we do see those signs in someone. So we've talked about how important it is for us having the AED around. Is there anything else we want to talk about on the subject of AED, CPR, cardiac arrest?
I was going to say AEDs can be used on children as well.
Oh, okay.
So I think that's important to know, is that if you are at a sporting event and a child is the victim, fetch that AED, because they can be used on kids. And when you turn if you haven't been trained, when you turn the AED on, it walks you through all the steps.
Okay.
It tells you what to do. Everything is should be in the case with the AED, and it'll tell you what to do. Anybody can do it, as long as you can follow direction.
And most of them even have a English-Spanish translator, so that if because like the socioeconomic status stuff that was out there for a while, if you are in a place where there's mainly Spanish-speaking populations and they turn on the English AED and it says the instructions in there in English, you can't understand it, but there's a button on them that lets you change it from Spanish to English, so it can be used in different areas. But like Julie said, the hard part is always if you're by yourself, and the question is, what happens if you're by yourself and there's a cardiac arrest?
Yes.
Do you do CPR? Do you call 911? Do you run and get the AED? And I would say it's never an easy answer, and there's no right answer, but calling 911 and starting CPR are probably the best things you can do. So if you call 911 immediately, and most everyone has a cell phone nowadays, so you don't have to run to a payphone. And their cell phones are on their wrists or in their pockets. So calling 911 and then starting CPR, because while the AED is what's going to help get the electrical activity restarted in the heart, if you spent 3 minutes or 5 minutes finding it, by the time you get back, the patient has almost a 0% chance of survival. Okay. So if you can do CPR for a couple minutes, and EMS can help get some people there. And there's now apps on people's phone that if once you call 911 and it says CPR, it alerts people in the neighborhood that carry an app on their phone that says, hey, there's CPR in progress over here, can you go help? And so there's people that just are, good Samaritans that on their phone just say CPR in progress, 2 blocks away, and they run over and they start helping.
That's amazing. Technology is awesome.
So getting that call out to 911 is super helpful, because those apps are monitoring the 911 channels, and they can tell people where to go and help with CPR.
So when in doubt, call 911. Yep. Then hands-on CPR right away, if we can.
Yes.
And hopefully we have people around that
can help, and that's the benefit of having AEDs everywhere. Somebody could bring one, someone can get one, someone can show up with one, and the AEDs are going to restart that electrical activity, which is the important, which is what's malfunctioning in the cardiac arrest.
Great. So Julie, I know that you talked again a little bit about resources. Anything else that you would like to mention about the free health classes or anything else?
So
where we can find the information?
Yep. So we offer quite a variety of things to the community. Like I said, most of it is free. Some things are nominal costs, but most are free, and they're every month all over the county. So to find those events that are going on, you can look on our calendar of events online on our website, or you can give us a call. Our number is 800-515-0044. That's the community outreach call line. And we can tell you what's happening in the community and where you can go. You can get blood pressure screenings, you can get stroke risk assessments, diabetes risk assessments, cholesterols in the community. We can give you your total cholesterol in 6 minutes with a finger stick. So there's a lot of opportunity to learn and have screenings in the community.
Yeah, and then again, we mentioned this earlier, I want to mention again, to see your primary care doctor. You want to see your primary care doctor once a year, or if you need to see them for any other reasoning. Is that correct?
Yes, absolutely.
Yeah, they can do screenings for, premature coronary disease. They can make sure you're on track and not at risk have risk factors like diabetes that you may not even be aware of and catch it early. So 100% primary care doctors need to be involved in following you. Even if you're young, it's once a year when you're young, which shouldn't be too stressful. But
yeah.
Yes, establish that relationship early.
Is there anything else that you both would like to add today?
I think like I said, the most important part is identifying early that a person is in cardiac arrest, starting CPR, and if the person looks like they may be struggling to breathe, not acting right, getting 911 and doing CPR early are probably the best things from a cardiac arrest standpoint that can be helpful.
Great. Thank you. And Julie, do you have anything else?
I was just going to say prevention.
Prevention, yes.
Don't get to that point and then you don't have to worry about it so much.
Great. Well, thank you. So that's all the time we have for today. I'd like to thank my guests on today's show, Dr. Abraham and Julie Sejak. If you'd like more information on cardiac arrests, please refer to the resources page after the show. And join us next time for another important health issue that matter the most to the citizens of Harford County. Thank you for watching.
You've been watching Public Health Matters, brought to you by Harford TV. Watch what matters.